One of the problems that can develop after prostate cancer surgery is urinary incontinence, loss of control of the bladder. Fortunately, it only occurs in a small number of men, and when it does occur, many of them will recover that function over a few months. Some men, however, are left with a nuisance level of leakage, enough that it causes them a problem, and we need to do something to try and help that. There are a number of procedures we can do. We obviously encourage the patient to do pelvic floor exercises to try and strengthen the natural muscles, and we give the problem enough time to improve. But typically, if the man is still wet by 6 months after surgery, he will need some sort of procedure. There are various procedures we can do to help incontinence after prostate cancer surgery. The simplest is we can use a telescope down the eye of the penis, and we can inject what's called a bulking agent into the wall of the natural water channel to try and bulk up the natural water channel so the muscles can close off more efficiently. Unfortunately, that really only helps men with very minor incontinence, and it may not be a long-term improvement. The next thing we can offer men who have incontinence after prostate cancer surgery is an operation that's called a urethral sling. And that involves basically putting a little mesh sling, a little bit like a hammock, that sits underneath the water tube. So it's a little mesh like this that sits underneath the water tube to lift it and support it. Very good operation for men with minor to moderate levels of incontinence. One of the problems, however, with that sort of sling is you have to get the right tension at the time of the operation, and you can't do anything about the tension later on if you haven't got it exactly right. A better type of sling is an adjustable sling. So again, this is a device that's put underneath the water tube of the patient. The sling is attached to the bones of the pelvis so it won't move. It acts like a hammock underneath the water tube. But this particular device has a balloon built into it so we can add fluid to it. This little valve sits inside the scrotum of the patient, and we can inject fluid in to increase the pressure in the balloon. So if the man has his surgery and he's not as dry as he wants to be, we can top up the device as an office procedure to ensure he's dry. I think adjustable slings have a lot of advantages over a non-adjustable sling in terms of being able to tailor-make the level of continence for the patient. For men who have very severe incontinence after prostate cancer surgery that can't be helped by the simpler devices, we have what's called an artificial urinary sphincter. This is a 3-part device, and it has a little cuff that goes around the patient's water tube to seal off the water tube. That cuff is closed off by fluid that sits in a little balloon that controls the amount of fluid in the cuff. And they have a little pump that sits in the scrotum. So the cuff is closed off all the time, so it's sealing off the water tube. When they want to pass urine, they have to feel the little pump, press on the little pump which opens up the cuff so that urine can pass, and then the cuff closes automatically afterwards. So even a man who is totally incontinent can obtain good bladder control with an artificial urinary sphincter.